So, hi everybody. My name is Brian Groves. I'm the Public Information Officer for the City of San Angelo, and today we're providing an update on COVID-19 in San Angelo. And so we're joined by Teresa James, our City Attorney, and Dr. Redis, who is our local public health authority. So thank you all for being with us.
Thank you.
Thank you.
All right, so Teresa, let's begin with you. The city began implementing regulations March 16th before COVID-19 had entered our community. Now, a month into this, how effective have these regulations been in slowing the spread of the virus in our community?
Well, I first want to say that we've had really great compliance. There were a lot of questions and a lot of really hard conversations when all of that started going into effect. But we've seen over time really good compliance, and I think we're seeing that reflected in the numbers that we're showing compared to other cities around here. I mean, we had an initial kind of little peak where we started getting cases, but those really have leveled off. I think the number today is 0. Yesterday was 1. The day before that was 1. So I feel like that what we're doing has been, pretty effective. I would defer to the doc on what he sees as far as that's concerned. I also think that the action that we took early, we were the first city to go to 50 people. The doctor issued an order before the governor did, limiting day surgeries and closing access to senior facilities. And I really think that has helped control some of the concerns that we're seeing in other communities as well.
Dr. Vredes, you want to add anything, or does she pretty much sum it up?
I think she did a great job summing it up. I think we started early and we may have kind of beat a hump there.
Okay. So you kind of touched on this already, Teresa, but when you look around at other West Texas cities, how is San Angelo faring?
I'm kind of a data nerd, and the doc is too. We've been looking at maps and all kinds of graphs and charts, and I've been keeping a map with a couple of our cities that are close to us. And we are faring, from my numbers and what they're reporting is their numbers, much better. Our curve is much flatter at this point. So I think that we're doing really well, regionally. As of yesterday, and I hope this didn't change today, I think we were the only region in the state of Texas that didn't have any hospitalizations for COVID. So I think that's another indicator that we're doing really well with what we're doing.
Right. Dr. Vredes, there appears to be a decrease in the number of tests being taken. Is that due to a lack of tests or less potential cases?
Maybe less interest in the public, to be honest with you. The testing facilities are ready to go. We have lots of test materials. I think the biggest question right now is, are people going to go in and get tested? And we're ready for it. Our turnaround times are now 1 to 2 days, where before they were up to 2 weeks. So come get tested if you want.
Gotcha. You kind of went right into my next question, which was kind of at the beginning of this. It was taking anywhere between 7 to 10 days to get test results. And you said now we're getting those between 1 or 2 days. What do you know what changed in regards to testing?
I think kind of a combination. At least Shannon, I know they switched to a different provider as far as a commercial lab, and the labs had had time to start getting spun up, and they're used to it now, so it's not quite as difficult. So, I look forward to the rapid test, but we're not there yet.
Well, you bring up a good point. So a lot of times everybody hears about these tests from the national media, from the president. When they mention these rapid testing or these antibody testing, we get a lot of questions on Facebook about that. How likely is it for us to see those kind of tests here in San Angelo, or when could we see that in San Angelo?
As far as the rapid test, 15-minute test, I'm pretty sure both hospitals have ordered the equipment. We're just waiting to get it. But again, we're so small compared to these large metropolitan areas. We're further down on the list to get them. So if we get them by the end of this month, early part of next month, I'll be real surprised. The antibody test, I get asked about those all the time. And unfortunately, there's just not a lot of data that supports the antibody test. I know just the United Kingdom spent $20 million ordering antibody tests from China. And then they announced today that they don't work, that they didn't actually detect antibodies from COVID patients. So a lot of what you see advertised, a lot of what you see on the internet, people say, sign up, I'll get this test. That stuff hasn't been proven at all. And we're not sure even if you have antibodies, are they what are called neutralizing antibodies? which actually kill the viral particle, or they what I call binding antibodies, which kind of catch hold of the virus, but they don't make it so it's not infective. So we got a whole lot longer to go before we're ready for antibody testing.
Gotcha. So in regards to positive cases here in Tom Green County, how have the positive cases been responding to the virus? We seem to have kind of a wide range of age groups, especially in the younger demographic. How has everybody been responding to the virus?
Most people have minimal symptoms at all, which I'm glad to see. I don't need to see people suffering with the disease. We do have a lot younger population than a lot of places are reporting, and that's just kind of good luck or bad luck and who happens to get exposed. It does go to show that there is no age that's, you can say, I don't have to worry about it.
That's a good point. So Teresa, sorry, hold on just one second. Okay, my bad. My phone rang. Teresa, what happens when someone has taken a test or test positive for COVID-19? What then happens with you and the local health authority?
Well, this is something else we started very early on in the process with Dr. Vredes. As soon as we get a positive test, I get information from the health department on the address of that person, the name of that person, and then I get a list also of contacts of that person. And all of those folks are issued either an isolation order if they are positive, or a quarantine order if they've taken a test or been exposed, to wait 14 days to make sure their symptoms aren't going to start or they're not going to test positive. We have had a couple of folks who have been out in the community. The community's been really great about letting us know when that happens. And we contact them. And at the time that they're tested, they're issued an order by Dr. Vredes as well, saying that you have to stay home. And so we contact them, remind them of that order. Dr. Vredes has done a great job of contacting folks to see the reasons why they're out in the community. Sometimes it's just they're trying to get basic needs met, and we're helping them to that. The people at both hospitals also have these care teams that go out and keep contact and make contact every single day and make sure that meals and things are provided to folks. So it's been a very inclusive process that I think has helped us keep track of people who are tested, as well as people who have come in contact with those folks as well.
Dr. Vredes, when patients are released from quarantine, are we retesting them? And can you talk about that process and what goes into that?
We're not retesting them to release them from quarantine. To be released from quarantine, or be released from, I'll start over. We're not retesting them to release them from isolation. To be released from isolation, they have to have had symptoms for a minimum of 7 days from the start of symptoms. They have to have had the last 3 days that they are symptom-free, so no fever, no cough. So the earliest you can get out of isolation is 7 days. If on day 7 you're still having symptoms, the earliest you could get out is day 10. If on day 14 you're still having symptoms, you may be day 17 before you're released. As far as getting out of quarantine, which means you've been around somebody who has it and we're watching to see if you develop disease, the minimum time is 14 days from your last exposure to that person. So as frequently happens that the person that's in isolation in the family gets released before the person who's quarantined, the other family members, because it could take up to 14 days for them to develop symptoms.
Gotcha. So just for those of you who might be joining us, my name is Brian Groves. I'm the city's public information officer. Joining us is our city attorney, which is Teresa James, and our local health authority, which is James Vredes. And we're just giving an update about COVID-19 in San Angelo, Texas. So Teresa, today Governor Abbott announced his plan to reopen Texas. In this, he mentioned that the state parks will open back up on April 20th with certain restrictions in place as well. Medical surgeries will begin loosening around April 22nd. And all non-essential retail stores will be able to go do a retail-to-go type service beginning on April 24th. On a local level, how does this impact us?
Well, I think on a local level, what it really impacts is, one, the hospitals who are going to be able to open up to more different kinds of procedures in a way that they haven't been able to do for the past few weeks. That's going to really relieve a lot of the stress and tension on those facilities. As far as the retail is concerned, I mean, we've tried, as we've gone through this process, to encourage retail providers to do call-in orders already. We haven't allowed them to have where you can like walk out to somebody's car. You can deliver something to their house or mail it to them, but we haven't allowed them be able to deliver something to their car. So that will be another alternative. People still will not be able to allow customers inside their stores. It will have to be carry out, delivery, or mail.
Okay. I know the governor is also planning on announcing a further update on April 27th, just to kind of reassess the situation. And I'm sure there'll be a lot more announcements when it comes to there. So we'll be waiting for those. So I guess talk about, since we're talking about the governor in the state of Texas, talk about how his orders work and how our orders work and whose supersedes others or things like that.
We actually have 3 different layers of orders. So we have the orders of the governor, and we cannot be less restrictive than what he has said to be. So if he's issued an order, we all have to abide by that if it's a statewide order, which his have been. We also have orders that Dr. Veretis has issued. His are solely based on medical criteria. So for instance, he closed the parks even before I believe the governor did, and before city council did. And that was based on medical concerns that were arising based on the use of those facilities. That applies countywide. And then the city council can apply rules within the city. And they can be more restrictive again than the governor, but they cannot be less restrictive. Now, I know today when I was watching the governor's press conference, I was a little bit disappointed that he's not turning more of those decisions over to local governments. And hopefully he'll do that on the 27th. I think that we did get in early and we do have really great numbers, and being allowed to evaluate our circumstances on the ground. You know, we've for a long time since this began had a system of color coding with the hospitals where we evaluate every week, you know, how many beds are available, how many critical care beds are available. Those same kind of criteria that he's going to use on a statewide level, we have on a local level. So hopefully we'll get a little bit more ability to make our own decisions and not rely so heavily on the governor's decisions in the coming weeks.
So as we start seeing reduction in restrictions, what would prompt those former restrictions to be put back in place?
Well, I think one thing that we would look at is, again, that color-coded system that we've developed with the hospitals. If we start seeing the number of hospital beds be filled and we're getting into the yellows and orange on those kind of concerns, that would definitely put more restrictions in place. I would think also that the doc would advise us that if we start seeing a large number in the increase of cases, particularly community spread cases, I could see that that might also impose additional restrictions.
So Dr. Veretis, recently we advised the citizens of San Angelo to wear a mask as the CDC advised everybody in the nation. Why is this important? And is this something that's going to become the new norm for the foreseeable future?
I'm sure masks are going to be the norm for at least the next year and a half, at the very minimum. The reason you wear a mask out in public, and especially the cloth mask, these are what are called a source mask. You put it on the source of infection. You don't wear a cloth mask to stop you from getting sick. Kind of explain it's pretty similar to putting a muzzle on the dog. When you put a muzzle on the dog, you're not doing that to keep the dog safe. You're doing that to keep the people around the dog safe. When you put on a cloth mask, it doesn't keep you safe. It really doesn't protect you from getting viral particles, but it does stop you from spreading. So if you're one of these people with asymptomatic COVID disease, you won't be spreading it to people that may not be asymptomatic when they get it. The more people that have masks on, the less likely we are to spread the disease within the population.
Okay. So we've heard recently all over the place about people, about the word herd immunity. What is that? Can you explain that to us?
Yeah, sure. Herd immunity is a concept that in order for a disease to spread within a population, you have to have multiple people that could be affected by that disease for it to spread rapidly. So if you have 100 people and all of those 100 people are susceptible to the disease, one person gets in with the disease, anybody they touch or come in contact with can spread the disease, and it keeps just expanding exponentially. If you have herd immunity where 50, 70, 80% of the population is resistant to that disease, and one person comes into that population, odds are most of the people they come in contact with are going to be resistant. So you're not going to be spreading the disease because the people you're in contact with can't catch the disease. Okay. You develop herd immunity either by having had the disease or a vaccine.
Okay. So Dr. Veretis, obviously Texas is a very large state. But do you feel like Texas and San Angelo has hit the peak in the curve that people reference all the time?
I don't know about the state as a whole. I'm hoping San Angelo, we have a little bitty nub and we never get that really huge peak, which is what it looks like we have right now. You know, we've done such a great job of keeping Angelo safe, keeping masks on, keeping social distancing, we may never get that point that we have that explosion. And I know it's been rough on businesses, it's rough on everybody. But if we could stop this from destroying our community, I think we've done a really great job.
Definitely. Is there anything else either of you would like to add or tell the citizens of San Angelo?
Well, I would like to thank the citizens of San Angelo for all the sacrifices they're making. I talked to hundreds, literally hundreds of people across the city in the last couple of weeks, and I understand that this is having a real impact on their lives. And every single one of our business owners who has a business closed, and every single one of our people who has a restaurant closed, and every single person who is out of work today is a hero in this. And I just appreciate so much what they've done to help us fight this battle.
Gotcha. Dr. Vredes, anything you want to add?
No, I agree with her. This has been rough on everybody. It's rough on the hospitals. It's rough on small businesses. It's rough on everybody. And I see, as a rule, we've come together like you expect West Texas people to do. We're saying, yeah, this is right for the community. This is right for everybody as a whole. It sucks to be me, but this is for the better good. And, it makes me really proud of our people.
Yes, sir. So as we wrap up, I just want to remind everybody, for more information on COVID-19 in San Angelo, visit our website at cosatx.us/COVID-19. We have a list of all the resources in the community, from help with businesses, unemployment, things like that. We also have the daily numbers, which get posted at 2 p.m., which are the test results and things like that. And we just invite you to go there to learn more information. And thank you for joining us.